Yeah. So good morning and welcome to our wellness workshop today on cancer-related cognitive impairments. That's a mouthful. And I will turn it over to Brenda to talk to us about this. Thank you, Brenda.
Good morning. I'm Brenda Crowley with Specialty Rehab. I am a certified occupational therapy assistant specializing in oncology. I'm here today to talk to you a little bit about cancer-related cognitive impairments, otherwise known as CRCI. So the objectives for this morning are to provide you with evidence-based information on this condition, to provide validation that this is a true phenomenon, to identify symptoms, to identify contributing factors, to provide you with compensatory strategies, to provide ways to reduce symptoms. And I do want to let you know that this education for this particular webinar is not intended for patients with brain tumor or brain metastasis. So some statistics. There are more than 16.9 million cancer survivors in the US today. By 2030, that number will grow to 22.1. Up to 40% of non-central nervous system, those are patients that do not have brain tumors or brain metastasis, will report cognitive changes during treatment. 75% report changes during treatment. Research suggests that this is not a progressive condition. So this is really good news. This is one of the most common questions I get from patients is this going to get worse? And the short and quick answer for that is typically not. There's no evidence that shows that this will progress and get progressively worse. So 60% of survivors report having symptoms of CRCI. 30% of those survivors report long-term effects of this. And I'll explain to you why that is in a little bit. So part of the confusion with cancer-related cognitive impairments is that it goes by lots of different names. You may hear it called chemo fog, chemo brain, cancer-induced cognitive impairment, cancer-related cognitive dysfunction, cancer-associated cognitive dysfunction. It's very confusing, but all of these names that we call it are all relating to the same condition. The reason that we've moved away from chemo brain and chemo fog is that the evidence now reflects that this is not a symptom of chemotherapy in and of itself, and we'll talk about that a little bit more. So we now know that this is a true phenomenon. We are able to see the changes in the brain through MRI. So I want to emphasize that we don't use MRI to diagnose cancer-related cognitive impairments, but we use MRI to support the fact that it truly exists and that there are changes that occur, but this is not how we diagnose it. So how is it diagnosed? We use what we call neuropsychiatric testing, and those are pen and paper types of tests that we run. But those don't really show us the whole picture, and I'm going to explain to you why. We use patient self-reported standardized questionnaires, which you'll fill out yourself. And then we use assessments that measure both function and cognition. So we're going to, ask patients to do some things for us, and we're going to observe how they do it and what their level of cognition is during those tasks. The self-reported questionnaires that we use they show us a better picture. So we had talked a little bit about the pen and paper tests. The reason that those tests don't show us the whole picture is that those tests are conducted in a very quiet environment. There's no distractions. It's just you with the paper and pencil, and you're going through the questions as the therapist asks them to you. So they don't really show us because, let's face it, most of us don't do tasks in complete silence. So what the patient reports is going to give us a better picture. We measure physical, mental, and social health. And we assess changes in your performance. So sometimes a patient will be able to make a cup of tea without any issues. They find the tea bag, they get everything that they need to put in their cup of tea. But if we add distractions to it, we turn a radio on or we start to talk, all of a sudden their performance changes. And those are the kinds of things that we are looking for when we do cognitive assessment. And the other thing that we measure is the level of fatigue and stress. So think about it. If you're very stressed or you're extremely tired, that is going to impact your ability to think. So they're all things that we use that you report to us that we can measure so that we can help you. So here are some things that patients report. They report difficulty multitasking, difficulty with routine tasks that requires more effort and more time, difficulty starting tasks. They get overwhelmed by the whole process. Attention problems. They start to do a task and then it loses their attention. They have trouble focusing, which is sometimes similar. And this is a big one, word retrieval. Patients are always saying that they're having trouble with word retrieval. So what is executive function? The definition that we use here for the purposes of this presentation, executive function encompasses a set of cognitive abilities that are critical to control, coordination, and regulations of thoughts, emotions, and goal-directed actions. So what exactly does all that mean? Your ability to start a task. If someone says to you, here's a cake mix, can you put this cake together? A lot of times patients will report that they don't know where to begin. They have a difficult time blocking out distractions. So they're going back to that cup of tea. They're okay doing it, but the minute someone starts to talk to them or the TV is on, it becomes very difficult for them to shut those distractions out and focus on what the directions were to make that cup of tea. They have a hard time holding thoughts in their working memory. So this comes into play with medicine management. It comes into play with bill paying and all sorts of daily tasks. They report difficulty with flexibility. So they may start to make that cup of tea and they might get distracted. Grandchild comes in and needs something, husband, wife asking for something, and then they don't know where they left off with that task. And they oftentimes have difficulty self-monitoring. So they're not really sure where the breakdown is, which is what we can do to help. We can help them with that. So the National Comprehensive Cancer Network, the NCCN, has come up with guidelines. They're national guidelines that we use to help patients assess whether they might be having some symptoms. Do you have difficulty paying attention, multitasking? Do you frequently leave tasks incomplete? Do you have difficulty finding words? Do you have difficulty remembering things? Do you need to use more prompts like notes or reminders than you used to? Does it take you longer to think through problems? Does your thinking seem slower? Do you notice an impact on functional performance or job performance? If you have answered yes, or any of these sound familiar, I'm here today to tell you that you're not crazy, that you probably have some cancer-related cognitive impairments. And yes, we can help. So what causes this? The cancer diagnosis itself is a contributing factor, which is why we've shifted from calling it chemo brain to cancer-related cognitive impairments. Just getting that diagnosis is overwhelming, and it impacts our ability to process information. The chemotherapy itself, radiation, the surgery, if you are a survivor who had to have surgery, the anesthesia, immunotherapy, which is another type of treatment, hormone therapy, which is another type of treatment, and stem cell transplant. They're all contributing factors to cognition, and of course, medications. We're going to talk a little bit about the chemotherapy. Estimated 13 to 70% of patients report cognitive impairments. Now, you'll notice that that is a really big spread there. Not everyone who has chemo reports it. However, patients do report it with chemotherapy, and a lot of it depends on the type of chemotherapy that you're receiving. We know that chemotherapy damages the DNA, which may contribute to the cognitive issues. We also know that the DNA damage causes inflammation and increases levels of cytokines known to cause deficits. So what exactly are cytokines? Cytokines are groups of proteins that are secreted by our cells, and they're the people that talk back and forth to each other. So they're the cells that tell us what is happening. So when they increase, it makes it more difficult for us to process information, or it impacts our cognition. And we also know that the harsher the chemo that you're on, it increases your risk. So some patients, every patient is on a different, what we call chemo cocktail. Cocktail meaning a couple of different chemo drugs that are mixed together that you get. So depending on the type of cancer you have will depend on the chemo cocktail. And also some patients are on chemo for shorter periods of time than other patients. They're on chemotherapy for a lot longer. So this impacts the level of cognition. The other thing is hormone therapy. So certain cancers feed off of hormones, hormones being your estrogen, progesterone, testosterone. Some cancers feed off of that. So we know that estrogen influences brain function. And research shows that stopping the production of that estrogen will reduce your risk of recurrence. So a lot of times, if you have a cancer that feeds off of hormones, they're going to give you a blocker for that. These hormone blockers can impact your attention, your verbal learning, your memory. And studies are mixed, but there is very strong evidence that shows the hormone therapy for breast and prostate cancer can impact cognition. That being said, this is extremely important. The hormone therapy that your doctor has prescribed to you, if they have done so, is extremely important. It reduces the risk of cancer returning. And I want to emphasize this again. Hormone therapy reduces the risk of cancer returning. So if you're having problems with cognition, the answer is not to stop taking your hormone therapy, because that is reducing your risk. If you're having issues, you want to have a conversation with your doctor and see if they can send you to therapy for cognitive training. These hormones reduce the estrogen and the progesterone that your cancer is perhaps feeding off of. So it's very important that you stay on those hormones. I can't emphasize that enough, but you do want to have a conversation with your doctor if you're having cognition problems. So why haven't I started treatment? Why I have started treatment yet and I'm having these symptoms? The stress of the cancer diagnosis is enough to cause patients to have issues with cognition. Think back before you had your diagnosis. If there was a day or that something had happened, a death in the family, a loss of a job, a child who was out late at night, think about how you felt when you were stressed. That stress level comes through and it passes and it moves on. But the stress of a cancer diagnosis lingers for a very long time. The stress of the medical expenses that patients incur with a cancer diagnosis. And we talked about the inflammation from those cytokines in the cancer itself. They all contribute to cognition. Some other contributing factors are pain, fatigue, and of course, we talked about that distress. So think about your pain level. If you are in pain, then your body is working to manage the pain. And because your body's working overtime to manage the pain, it impacts your ability to think clearly. Same thing happens with fatigue. If we're extremely tired, for those of you who have children, think about those years when the children were young and you weren't getting a lot of sleep. It's hard to concentrate. It's hard to do your daily tasks. Well, a cancer diagnosis, there's cancer pain, there's fatigue that comes with it, and there's the distress. And they all impact our ability to think clearly. Some other contributing factors are sleep dysfunction. So we kind of tapped into that a little bit. When we are treating a patient with cancer-related cognitive impairments, we do what we call sleep diaries. It's really important that we get good sleep. We measure anxiety and depression. And we also measure, discuss nutritional changes. It's important to have a good diet. If you are feeling depressed, it's important that you speak to your nurse navigator and get referrals to psychosocial, and so that you can manage the depression and the anxiety. We talked a little bit about stress. We're going to talk about it a little bit more. We know that the nervous system can handle short bursts of stress, good and bad, for short periods of time. That's that teenager who's out at night and hasn't come home yet, and we're really worried. We can handle that. We can manage that. We can manage the stress of a job loss. We can, they're shorter intervals of stress. The cancer diagnosis is a stress that lasts for a much longer period of time, with lots of other factors that play into it. This is very difficult to manage, and as a result of it, it does impact cognition. Typically, once we handle our stress, our systems rebalance, but with cancer, that doesn't happen as easily. And we also, just to reemphasize, the cancer creates a continued stress and inflammatory response. So what do we do about it? We know that managing stress and pain is important. So if you're in pain, I'm a therapist, I'm not a doctor, but if you're in pain, you need to manage that pain with your doctor. You want to stay ahead of pain. So if your doctor prescribes pain medication to you, you want to take that pain medication as prescribed. You don't want to wait until the pain is a 10 out of 10 before you take your pain medication. You want to manage the pain because managing the pain is important. It reduces the stress and it also helps you heal better. Some of the things that we can do, that therapists can do to help you manage stress and pain is relaxation breathing. So there's lots of evidence that shows breathing techniques can reduce pain and stress by 2 or 3 points. So I can speak to this within my own practice. Patients come in, they report that their stress levels are 10 out of 10. We do some very gentle relaxation techniques and breathing techniques, and we're able to bring that stress level down to oftentimes like a 7 out of 10, which is a significant change, and it helps patients. We do guided visual imagery, meditation, exercise, and yoga. So we talked a little bit about managing the pain. We don't want you to suffer through pain. We want you to discuss this with your doctors and take your pain meds as prescribed. And then if you're coming to OT or PT, we manage pain through physical exercise, breathing techniques, meditation. We're going to move on and talk a little bit about fatigue. The NCCN categorizes cancer-related fatigue based on a patient's report of their fatigue level and how they perform their activities of daily living and instrumental activities of daily living. Regardless of the level of fatigue, it is recommended that patients participate in some level of physical activity. So what does that mean? We want to be able to balance work and life. So we want to use what we call energy conservation techniques. When you are reporting fatigue of 8 out of 10, it's important that you use energy conservation techniques. So what does that mean? That means if you're sitting and you're watching TV, but you also need to prepare dinner dinner. When you get up to use the toilet, we want you to maybe think ahead and say, you know what, I'm going to take out the hamburgers because we're having hamburgers tonight. I'm going to take those out of the freezer on my way to the bathroom. So rather than sit back down and get up again, which takes a lot of energy, we're conserving that energy. We're keeping things at a waist height so we're not always reaching. It takes more energy to reach up overhead than it does to reach in front of us. So there's lots of little strategies that we can provide for energy conservation. However, the flip side of that is we don't want you to be sitting all day. So we want you to get we want you to avoid inactivity, but we also want you to respect the fatigue. We want you to take frequent rest breaks. So if you've returned to work and you're feeling fatigued, we want you to take that, 5 minutes to do some quiet relaxation and breathing techniques to take that break. We want you to save the most difficult tasks for your best time of day. So if you're paying bills and that's an issue that's a task that's really difficult for you, and you find that after you've had breakfast, that's the best part of your day, we want you to do those difficult tasks at that best part of your day. We don't want you to save those for evening time, especially if you're someone who has returned to work and you're working a full day. Save that bill paying for the weekend during the best part of your day, rather than try to tag it on to the end of a work day. And pace yourself. We want you to balance your activity and your rest. And it's like this person here walking the tightrope, and oftentimes that's what life is. It's walking a tightrope, balancing what you have to do at work and what you have to do at home. And this is the most difficult one for patients, is to delegate. It's okay to say, you know what, it's your turn to cook tonight. It's okay to say, you need to clean the house this week. Ask your friends for help. When people offer to help you, it's because they want to help you. And if they, so you need to say, you know what, can you stop on your way home? If a neighbor says to you, do you need anything? It's okay to say, yeah, if you're going to go by the store, do you mind picking me up a gallon of milk? It saves you from having to go out. So those are the kinds of things that we want you to do. It falls into the energy conservation as well. So how do we handle the fatigue? We know that physical activity helps with fatigue. As crazy as that seems, activity helps us feel less tired. So we want you to maintain your desirable activity level. If you're not in a program, once you have clearance from your physicians, we would like you to start a program. If you're unsure what to do, you can get a referral to physical or occupational therapy. Exercise should include both endurance, which is going to be cardio, and resistance training, which can be lightweight training. You can do yoga. There's all sorts of things. My personal opinion on physical activity is find something you love. It's a lot easier to find an activity, to keep an activity that you love, than to choose an activity that you don't like and to stick with it. So if it's gardening that you love, do gardening. That gardening is a physical activity. If it's working on cars and you want to be doing that, anything to keep you moving and active. You can put in short bursts of exercise. We now know that it doesn't have to be a 30 or 45-minute workout. 10 minutes of cardio exercise and a little bit of strengthening exercise is better than no exercise at all. So again, get the clearance from your doctors. If you're unsure what type of exercise you should be doing, a referral to PT would be advisable. So why do we exercise? Exercise and psychological interventions are effective for reducing cancer-related fatigue during and after cancer treatment, and they are significantly better than the available pharmaceutical options. Clinicians should prescribe exercise or psychological interventions as a first line of treatment for cancer-related fatigue. So in a nutshell, what this is saying is that rather than taking pills to manage your fatigue, try a little bit of exercise. It doesn't mean that pharmaceuticals don't have a place in cancer care, because they do, but exercise is free. There's very few side effects to it, and it's available to everybody. Taking a walk, even if it's within the main floor of your house, it's free, it's easy. If you become, if it's too much, you can stop and sit. So this is what we always recommend, is exercise. So there's evidence that shows pairing exercise, physical activity, with cognitive training helps improve cancer-related cognitive impairments. It improves the processing speed. With patients report that it improves their processing speed after just 12 weeks of combined treatment. So when we treat a patient for cancer-related cognitive impairments, there's a physical piece that goes with it, and then there is going to be your cognitive piece. It may be doing puzzles, it may be doing word games, but the combination of those two improve cognition. So the National Commission on Cancer Network for 2020 guidelines, survivorship guidelines, are as follows. Regular physical activity. So we want to avoid inactivity. We want to limit the use of alcohol and other agents that can alter sleep and cognition. We want to explore mind-body techniques, the yoga, the meditation, the stress reduction, all things that we've talked about. Sleep hygiene. We talked a little bit about this. Maintaining a regular bedtime and wake time. For those of you who may not have appointments in the morning or have not returned to work, we still want you to set that alarm clock and get up at the same time every day and go to bed at the same time every day. We want you to get regular exercise, but we want you to avoid that exercise 3 hours before bedtime. We want you to limit your caffeine and avoid caffeine about 4 hours before you go to bed. And although we encourage naps, we want you to limit your naps to 30 to 45 minutes and try to avoid them in the late afternoon because they will impact your sleep. So what is the ideal sleep setting? The place where we sleep, the bedroom, should be for sleeping and sexual activity only. We don't want eating in the bedroom. We don't want the gaming, the drinking, the iPads. Try to make your bedroom a quiet place where it's restful. We want to reduce bright lights before we go to bed. We want to eliminate screens. I mean, this is really important, using electronics in bed. There's lots of evidence that shows it impacts our ability to fall asleep. If you're having difficulty falling asleep because all of those events of the day are racing through your head, try doing some breathing techniques, deep diaphragmatic breathing in through your nose and your belly rises and you exhale slowly through your mouth. If you think about the breath, then you're not thinking about all those things that are come flooding in when the minute your head hits the pillow. It's important that you have a depression screening, and these are just some of the things that we include this when we treat all of our patients. If you're experiencing nearly every day, this would be a reason for you to speak with your doctor and get a referral. Identifying symptoms. So mild forgetfulness, word finding difficulties, difficulty remembering dates, appointments, and phone numbers, trouble concentrating, difficulty multitasking, and taking longer than usual to finish routine tasks. So some of the strategies that we incorporate in therapy is time management skills. We use memory aids, calendars, sticky notes, verbally speaking to ourselves. So self-talk is a huge way to help us with remembering things. So if we're going to put a sticky note on the refrigerator to remember to pick up milk, when we're doing the action of putting the sticky note on the refrigerator, we may say, you know what, I got to pick up milk on my way out today. So that involves it involves multiple senses. So you've got the action of putting the sticky note on the refrigerator, and then you're vocalizing it. And so that's your motor on your mouth saying, I got to pick up milk. You've got the visual, which is your sticky note itself. And you've got the auditory because you've said it out loud. So those are the kinds of strategies that we use to help people remember things and keeping things in the same place. So find that special spot near the door that you put all the things that you need to take with you before you head out the door in the morning. And for those of you who use smartphone technology, the smartphones can be very helpful in remembering what to pick up at the store. There's lots of things. And these are things that we use when you come to occupational therapy for cognition. And then we do work modification. And again, we're going to save those most difficult tasks for the best time of your day. So we create an individual treatment plan. We educate on the condition. We are going to create an individual exercise program. We're going to incorporate stress management techniques, energy conservation and pacing techniques, training and compensatory strategies for problem areas, and we're going to assess your sleep hygiene. And then we'll do some mindfulness training. So some key points for you to take away today are cancer-related cognitive impairments is real. It has been medically validated. Therapy can help with the symptoms. Cancer-related cognitive impairments are not progressive, meaning symptoms will not worsen. Managing stress, anxiety, pain, and sleep will improve these symptoms. Combined cognitive therapy with exercise works best. So I will wrap up now and we'll answer any questions.
Thank you so much, Brenda. Before we open it for questions, I just want to mention that we do here at Cancer Support Community Delaware, we have a lot of the kinds of programs that you mentioned that are important: meditation, exercise. We have a walking group, yoga classes. We also have a group health coaching program that we run that teaches a lot of the skills that you talked about. So just wanted to mention that because I thought good complement to that. And if anyone who might be listening to the recording has questions or wants more information, you can email me for that. And just want to remind everyone that we're going to talk more about fatigue management, which I know you touched a little bit on today. That will be on Thursday, August 11th. All right. So